Well, good morning, everyone. I'm Dr. Jim Allen. I'll be moderating today's COVID health and wellness briefing. The purpose of these briefings is to give members of the media direct access to some of the COVID-19 experts at The Ohio State University so that you can help support the statewide communications efforts with science and medical information. Let me introduce today's experts. Dr. Jonathan Parsons is the Executive Vice Chairman for Clinical Affairs of the Department of Internal Medicine and is also the pulmonologist leading the OSU COVID-19 monoclonal antibody program. Elizabeth Seeley is the Chief Administrative Officer of the Hospital Division of the Ohio State Health System. Let me first give you a little bit of update of where we are regionally. Columbus is in Zone 2. Recall that Ohio was broken into 3 zones, and in Zone 2 here around the Columbus area and Southern Ohio, we have had declining numbers for the past 6 days in a row with less than 700 cases per day. To put that in perspective, our peak was 1,204 cases in Zone 2 of Ohio on December 9th. The peak here at Ohio State is also dropping, and we're seeing less than half of where we were in our original peak back in December. Let me start with a question to Dr. Parsons. We've been hearing a lot about the monoclonal antibody therapy for mild and moderate cases of COVID-19. What exactly is monoclonal antibody therapy and how does it work?
Yeah, thanks, Jim. So monoclonal antibodies are basically an infusion of proteins that are targeting the spike protein on the surface of the coronavirus. So remember, the spike protein is what part of the coronavirus that attaches to the cell that allows the virus to enter the cell and cause damage. And so what our goal is with the infusion is to try to bind that spike protein before it can bind to the human cell and create damage, thereby protecting the lungs and other organs from having injury.
How do patients get the monoclonal antibody? Do they have to be referred by their primary care physician?
So there are many ways to do it, but the easiest advice to patients is to contact their primary care provider if they receive a COVID test that's positive. Here at OSU, we leverage our electronic medical record to facilitate referrals from primary care and medical specialists to arrange for infusion. But the best advice for all patients is the first step is to contact their primary care provider with a positive test.
Well, question for Elizabeth Seeley. How long has Ohio State been offering this to patients and how many patients have been served so far?
Sure. So the first of these infusion therapies was approved by the FDA for emergency use on November 9th. And then we actually received our first shipment on November 16th. And that very same day, we infused our first patient. So it's a very quick turnaround. And then since that time, since November 16th, we're now have infused 1,100 patients with this therapy.
How has the therapy benefited not only the patients, but also the OSU health system?
Of course. So first of all, the immediate benefit to the patient in avoiding more serious complications that might require hospitalization. So based on the clinical literature shows that about 10% of every patient who gets COVID may be at high risk for severe disease requiring hospitalization. And by receiving this medication, the projections were that that 10% could be reduced to 3% needing hospitalization. Our experience has actually been even better than that. So since we've infused our first 1,075 patients, only about just over 2% of them have actually needed to be hospitalized. So in other words, we've avoided, for those patients, about 82 of them have not had to be hospitalized. So that's a tremendous benefit for those patients, not having to have that hospitalization. So on top of that, what that's allowed us to do at the health system is to preserve our capacity for additional patients who need hospitalized, both those with COVID and those without COVID. So as a result of that capacity freed up, we've been able to take care of an additional 160 patients who need access to high intensity, time sensitive hospitalization.
Well, Dr. Parsons, what have you heard from patients after they've received the monoclonal antibody therapy?
Yeah, it's been very rewarding. I've been at OSU for over 20 years, and I could say that this is probably my most rewarding clinical experience. We've had numerous patients reach out who were terrified once they received a positive diagnosis of COVID that uh, the consequences could have been dire. We've had people who have cancer, who are immunosuppressed. We've had pregnant patients, young patients, and we've have infused patients in their 90s, all of whom have reached out to say thank you for allowing us to infuse them and to shorten their illness and potentially, as Elizabeth mentioned, protect them from hospitalization and potential dire outcomes. So it's been really a fantastic experience.
Well, in addition to your hat overseeing the monoclonal antibody therapy, you're also integrally involved with the vaccination program for the COVID vaccine here at Ohio State. How's the vaccinations going so far?
So the vaccine, as most of you know, we've moved our vaccine operations to the Schottenstein Center, where we've opened up in the last week or two to the general public, and it's gone fantastically well. We've started with our patients who are above the age of 80, and we'll sequentially move down in age groups as we go. I can tell you that a lot of these folks have come out, and this is the first time they've left their house potentially in multiple months, and have been extremely thankful and grateful for the opportunity to come and get vaccinated. A lot of great anecdotal stories about their experiences navigating COVID. And again, another fantastically rewarding experience as a provider here at OSU.
How's the vaccine supply been?
So we are using 100% of the vaccine supply that we are allocated on a weekly basis by the state of Ohio. So our clinical operations has been fantastically successful in protecting our vaccine supply and managing to use all the supplies that we get on a weekly basis. So we are scheduling out based on our projected allocation from the state. And so far, so good.
Dr. Parsons, getting back to the monoclonal antibody therapy, which patients are eligible to receive it?
Yeah, great question. So it's not indicated for everybody. So very simply, any patient above the age of 65 would be a candidate. Patients who are 55 and above with comorbid conditions, cardiopulmonary conditions such as hypertension, COPD, or asthma. Patients who are immunosuppressed, who are on chemotherapy or other medications that depress their immune system. Pregnant patients would be an indication too, although we would advise those folks to have a conversation with their obstetrician before they would be infused. And then patients who are the ages of 12 to 17 who have congenital anomalies or other congenital conditions would be candidates as well.
Is there a certain time frame after the onset of infection?
Yes, so that is one of the challenges in getting patients infused in a lot of locations is that Food and Drug Administration has mandated that the infusion has to occur within 10 days of the onset of symptoms. And so for a patient to become symptomatic, get tested, get their test result back, and then navigate the process to get infused, sometimes it is a challenge to get some of these patients infused within that time window.
Ohio State has given one of the largest numbers of these vaccines in the United States. How has Ohio State been able to be effective in getting so many doses out to patients?
Yeah, I mean, it's a great question. And I think it's an example of amazing teamwork. And it started with building an infusion center at East Hospital that used to be an auditorium that we would use for continuing medical education. I think it's important to realize that many medical centers have an infusion center, but we don't want to intermingle people who are patients that have active COVID disease with those patients that usually go to infusion centers who often have immune deficiencies. And so getting a freestanding infusion center, and then we've leveraged our electronic medical record in a tremendous way to identify our patients and then facilitate referrals electronically that can be basically referred the same day and then scheduled the same day in a lot of cases for infusion.
What about patients who come into the emergency department?
Yes, we do have a workflow for patients who meet the criteria who come in through the emergency department. Obviously, we have not advertised or encouraged our patients to go to the emergency department specifically to be infused. But we do have a workflow in place that can infuse patients there. As Elizabeth mentioned, we've infused about 1,100 patients, and about 150 of those have been through our emergency department.
Does getting the vaccine or getting the monoclonal antibody affect your ability to get vaccinated?
The short answer is no. There is a time issue to be aware of, however. So if a patient gets infused with monoclonal antibody, they really need to wait 90 days from that infusion date to get a vaccine. And the reason for that is that we don't want to intermingle the immune response of the antibody infusion with the immune response of the vaccination at the same time.
What about the vaccine as far as your experience with the second dose? We've heard that patients have somewhat different experiences after the first dose or the second dose. Have you seen any severe side effects, and what should people be expecting when they are coming in now for their second dose?
So we've vaccinated over 20,000 patients at OSU, and I would say 99.5% of those patients have done very well. We have had some patients that have had some substantial systemic symptoms more often after their second dose of their vaccine, specifically myalgias, muscle aches, fevers, fatigue that have been short-lived but been fairly significant, requiring a lot of specifically employees to have take a day off of work after their second dose. But we have not seen hardly any systemic major reactions from either one of the first or second dose of the vaccine.
Well, a question for Elizabeth Seeley. There are a lot of people who work at our country's medical centers and hospitals. How are hospitals such as Ohio State deciding which frontline healthcare providers would be prioritized to get the vaccines?
So first and foremost, each hospital, including us here at Ohio State and all the hospitals in Ohio, follow the state guidelines. And different states have put out different guidelines for prioritization. We used a very in-depth and thoughtful process to follow the state guidelines regarding individuals who would be eligible to receive the vaccine. And we included a large multidisciplinary group, including medical ethicists, clinicians. We had support, obviously, from our IT group in identifying those individuals who perform care in the most highest risk settings so that we could prioritize them first. So for instance, anybody who works in one of our critical care units or works in the emergency department. And we were very thoughtful that it wasn't just physicians or nurses, but we included the entire team of individuals who work in those settings who come into frequent contact with patients with COVID. So whether that's the individual who's delivering meals, who's cleaning the room, the pharmacist, a social worker, anyone who would have contact within those settings were prioritized. So it was an approach that we took based on the risk of contact with patients in those specific settings. And then we looked across all disciplines and all individuals providing care in that setting.
Dr. Parsons, we've seen pictures on the news of other states where the vaccination sign-up process and the vaccination sites are somewhat chaotic, and there are inequities in who gets the vaccine, long lines at the vaccine station. Why did you choose the Schottenstein Center, and what has been the experience at the Schottenstein Center compared to some of these other states?
Yeah, so we chose the Schottenstein Center basically because we wanted an area that we could do a lot of vaccinations on the same day. So for example, yesterday was our largest vaccination day, and we vaccinated over 1,800 patients yesterday. And the shot really affords us a space where we can honor the public health principles of social distancing and yet still vaccinate a large number of patients on a daily basis. Our operation there, I'm fairly proud of it. I think is running fantastically well. We managed to keep people moving through the lines, and most people can get registered and in and out of that facility within 45 minutes of arriving, which is not the experience that a lot of other facilities across the country are having. And a lot of this was pre-planning from a tremendous operations team, multidisciplinary operations team from physicians, nurses, medical professionals, IT facilities who've built an area to be vaccinated that really maximizes the legitimacy of success on a daily basis.
It's also, just to add on to that, it's also a site that's used to handling high volume of traffic. When you think about the number of people who come in their cars to a sporting event or an entertainment event, that we've had tremendous support from the university staff who are at that location and are used to handling flow of large numbers of people. So that's also been an advantage for us in using that site.
I think when most people think of the Schottenstein Center, they think of the basketball arena, hockey arena, concert arena area. Is that the portion that you're using, or are you using a different part of the Schottenstein?
Yeah, we're actually using the concourses. So we've got entrance through the northeast rotunda, and then we're able to have two parallel operations running in the concourses. So we do not have individuals, down on the court, so to speak, but we've set up socially distanced, appropriately spaced tables and chairs lining the concourses. And that way we're able to also maintain a flow of traffic one way into the concourse. And then once an individual has received their vaccine and has been monitored for the appropriate amount of time, we're able to have that flow of exit out of the concourse without crossing paths.
Well, Dr. Parsons, one last question about the monoclonal antibody therapy. These patients are often feeling pretty sick from their COVID. What should they expect when they go to get an infusion? How long does it last? Do they need to be monitored afterwards? How is the medication delivered?
Sure. So if you're referred to an infusion center, typically it takes about an hour to get registered, get seated, have an IV placed, have consent presented, and have a sort of an instruction period of what's going to happen. And then the actual infusion itself takes about an hour itself. And then we watch you for about an hour after the infusion is ended. So it's about a 3-hour process in general. And we're able to, when at our busiest infusion days at our infusion center, get about 35-ish patients infused on a daily basis. So it's about a 3-hour commitment of time.
Well, let me thank today's panelists, Dr. Jonathan Parsons and Elizabeth Seeley. Let me thank each of you from the local media for the role you're playing to keep the people of Central Ohio up to date on the COVID-19 pandemic. We'll be back next week as needed in order to talk more about the latest news on COVID-19. And until then, wear a mask, practice hand hygiene, and get your vaccination as soon as you're able to.